Allya and I have done our presentations on smoking and how it affects different people in different ways. Allya focuses on how the genders are affected differently by smoking, while I focus on the mental cognition effects of smoking in all people. First, here's Allya.
Cigarette smoking gives more respiratory symptoms among women than men. Dr. Arnold Langhammer and his colleagues were interested in how smoking cigarettes caused various symptoms amongst people, but more specifically in females. Previous studies have shown that women show more signs of respiratory symptoms than men. Further, they are more likely to be admitted to a hospital and be diagnosed with chronic obstructive pulmonary disorder, or also known as COPD. For their study, they wanted to see any similarities in respiratory symptoms and disease in a large group of population regarding their age in a range of 20 to 100 years old, sex, currently smoking, and smoking for a longer period in their lifetime. They set their study in a specific county in Norway, a perfect place for the research due to the area having little to no industrial pollution. The population in 1995 was 127,000 residents, with 97% of them being Caucasian. People in the county were invited to participate in a study by answering a questionnaire that related to health, respiratory symptoms, and smoking. Some examples of the questions include: do you cough daily during periods of the year? Do you have or have you had asthma? Do you smoke? Have you been diagnosed as having chronic bronchitis or emphysema by your doctor? Researchers also took into consideration of the non-responders. To obtain more data, they randomly selected those that did not voluntarily participate in the study and interviewed them through the telephone. Those that did not answer after 3 attempts, a questionnaire was mailed to them instead. Through statistical analysis, researchers were able to obtain sufficient results. Based on the data, the more cigarette packs an individual smokes, the more likelihood that they will have symptoms of wheezing and shortness of breath. Further, there is a likelihood that they will be diagnosed with asthma due to their symptoms. Interestingly, females showed more prevalence in both qualities than men. Similar results can be seen in another graph. Symptoms of persistent coughing as well as coughing with phlegm were seen more in those who smoked more packs in a year. Additionally, those that were diagnosed with chronic bronchitis were more prevalent as people smoked more. Lastly, and on an interesting note, females showed more prevalence in each category compared to men. There are other key points from the results that must be addressed. For instance, more women were current smokers than men and could have potentially skewed the results. Further, more people were either diagnosed with asthma or currently taking asthma medication compared to previous studies in the past. Interestingly, there were less participation done in each group, especially in younger men. This may be due to people being skeptical. They have to work around their schedule, and participating can be time-consuming. To conclude, the studies showed that there is a clear relation between respiratory symptoms and number of cigarette packs smoked. Additionally, there is a slight difference in the response between the sexes. Female responses had more prevalence in respiratory symptoms and diagnosis compared to men. Even though women are pressured by the society and the family to quit smoking, women are less likely to remain abstinent than men. Females having higher prevalence of respiratory symptoms compared to men can be a variety of reasons. Dr. Langhammer states they may be due to the result of losing weight from smoking cigarettes. Because young women are more susceptible to smoking than men and they show more symptoms or are diagnosed quicker in their lives, women may be at risk of smoke-related disease in the future. Dr. Langhammer and others emphasize that there should be programs for adolescents to learn the dangers of smoking cigarettes. Now, it would be interesting to see how cigarettes affects the mind.
Hi, my name is Alicia Van Stone, and I did my article on smoking and the effects that it has on the brain. The article that I chose to do research on Was acute cigarette smoking reduces latencies on a smoking Stroop test? The question that this experiment attempted to answer was, how does smoking affect mental cognition? The goal of this experiment was to determine if the presence of smoking-related words on a Stroop test caused a delayed response, and whether having recently smoked had an impact on the smoking-related word bias. A Stroop test is a test that shows words in different colors, where the colors must be reported back quickly. The goal is to repeat the visual colors back as quickly as possible without saying the written words. Their hypothesis was that a word bias would exist when smoking words were used, and that withdrawals for extended time would increase the Stroop test bias. They expect to see smoking participants take longer to respond on a Stroop test when the words involve a smoking word. This experiment used a very selective group of participants. By using a variety of participants who did not have any cognitive issues and were of various ethnic backgrounds, the results of a smoking bias were obtained. By using a variety of participants of different ages, races, and educational backgrounds, the results were obtained with a minimal bias. This experiment was carefully constructed as to reduce bias between smoking and non-smoking words. Each participant was allowed 6 minutes to complete the Stroop test, and each word was presented in Helvetica font size 72. There were 26 words presented with a 3,000 millisecond break between each word. These are the results obtained from a variety of smokers. Half had smoking-related words, and the other half did not. On each half, there were differences in the amount of abstinence in hours that a participant had from smoking, and as shown below, the number of participants with a higher amount of abstinence resulted in a very high bias between smoking words. After being abstinent from smoking for 13 to 16 hours, the response time was much longer for smoking words than non-smoking words, whereas less than 1 hour of abstinence resulted in only a slightly higher smoking word bias. This difference shows that after craving a cigarette, bias goes up unconsciously with each smoking-related word, indicating that as cravings for a cigarette go up, bias increases. In conclusion, the withdrawal from smoking does have a psychological effect on the mental cognition rate and increases hesitation among participants. This discrepancy increases over time, showing that withdrawal can worsen over time. If this experiment were to be repeated, perhaps it would be a good idea to have an equal sample of non-smokers that are also tested on both versions of the experiment.